Linda Burney is the Shadow Federal Minister for Indigenous Australians and Family and Social Services and joins us this morning. Morning, Linda.
Good morning. It sounds very chilly out your way.
It's freezing this morning, but it's quite nice here in the studio. Thanks for your time this morning. We were talking a bit later on in this half an hour, actually, about how in New South Wales we've ticked over the 50% of people statewide who have had at least their first vaccination against COVID-19. We learnt last week at the start of this outbreak in Dubbo that less than 10% of the Indigenous community around that area have had their vaccine. Something's gone quite wrong in the middle there.
Something has gone very wrong, Ewan. What I am worried about is the lack of preparedness by the federal and the state governments for what is an area out your way that has such high Indigenous populations. And of course we know that is a very young population, and what we see in Dubbo, Walgett and Burke overnight, where there are now infections, it's very young people, and the vaccination rollout to me is not terribly coordinated, and there seems to me to be the requirement for a massive effort, particularly from the federal government, about making vaccines available and into people's arms.
Is there much point in looking backwards at what kind of might have gone wrong here, or should we really be focusing on what we can do to fix it now?
I think there needs to be both. I mean, we need to know what the lessons are, because there are sizable Indigenous communities right across the country. But if you think about the Western Division, like west of Dubbo, we're talking about 50,000 people. It's not insignificant, and people would know towns like Brewarrina and Burke and Wilcannia that are almost entirely Aboriginal, and of course there are large Aboriginal populations in West Dubbo in particular, where so many of these cases have appeared. The thing that I am advocating very much, Ewan, is what we know that works, and I am saying that there needs to be better coordination across the many health bodies in the region. There's a need for pop-up clinics, but what works is going door to door. Now, that might sound labour-intensive, but it actually works, and there is a crisis out there, and it's just going to get bigger and bigger. And if taking the testing, if taking the vaccines to people in their homes is what works, and that's what's required.
A lot of people have kind of pointed their fingers in recent weeks, Linda, at a lack of vaccine availability. But in some of these cases, it does sound more like it was a lack of communication directly to some of these communities, perhaps a little bit allowing some hesitancy to creep in, those sorts of things as well.
I think it's both, Ewan. I mean, there has been not enough vaccines available out in that area. When you look at the vaccine rates in some places, it's as low as 2%. Hopefully it's improved in the last few days. But there are fabulous people out in that area. I mean, I know I saw Riverbank Frank's video that I know has been used so many times. And the governments need to draw on that expertise because it is just sitting there. And it seems to me that the availability of vaccines is crucially important, and having mass vaccine hubs is good, but what needs to happen is pop-up clinics and door-to-door in those places. Look, you know, the Delta variant, we all know, is absolutely deadly. And when you've got the profile and the demography of your part of the world, which is well understood, there should have been more done in preparation, absolutely.
Okay, so there are lessons, you think, to learn for the rest of the country, perhaps?
I think there are enormous lessons to learn, and the government at the federal level, as you mentioned in your introduction, said that Aboriginal people were a priority. Well, why are the vaccination rates so low? I was talking to mayors from the Pilbara, Kimberley region the other day, and they just said vaccination rates out there are the lowest in the country. Something around 8%. Now, that is unacceptably low, and the question needs to be asked why, and expertise and advice sought to how to improve that. And I can assure you that door-to-door visits are really effective, making sure you've got trusted and recognised people from within the community that would willingly assist in this endeavour.
Yeah, don't overthink it. Back to basics in some respects. Yeah.
Yeah.
Linda, Burney, nice to talk to you this morning. Thank you.
Thanks, Ewan.